Most people hear about the keto diet because they want fast weight loss. But what if I told you keto is not just a weight loss trend, it's actually a powerful metabolic therapy used for decades in medical science? Today, I'll break down everything you must know before starting keto, especially if you live in the USA or Europe, where carbohydrate intake is generally high and metabolic diseases are rising rapidly. This is the complete doctor-explained keto guide, simplified so anyone can understand it. And remember, for more important health advice like this, make sure to subscribe to the channel. Let's begin. Number 1. What exactly is the keto diet? Simple explanation for everyone. The ketogenic diet or keto diet is a low-carb, high-fat eating pattern designed to shift your body into a metabolic state called ketosis. In everyday life, your body runs on glucose from carbs. But when carbs are extremely low, usually below 20 to 50 grams per day, your liver starts producing ketones, a clean, efficient fuel source. Why this matters? Ketones burn more steadily than glucose. You avoid the sugar crash common in high-carb diets. Your body becomes a fat-burning machine. Appetite naturally decreases. Doctors originally developed keto for epilepsy patients, but today it is widely used for weight loss, insulin resistance, PCOS, prediabetes, and early metabolic disorders across Europe and the USA. Number 2. How keto helps with weight loss. Science-based explanation. People often ask, why does keto work so fast? There are 5 scientifically proven reasons. 1. Keto reduces insulin levels dramatically. Insulin is the fat-storing hormone. When insulin drops, your body finally unlocks stored fat. 2. Keto suppresses hunger naturally. Studies from Harvard and European nutritional journals show that a high-fat, low-carb diet significantly reduces ghrelin, the hunger hormone. That's why people on keto feel full for long periods. 3. Keto increases fat burning rate. Your liver converts fat into ketones. This means your body is burning fat even when you're sitting still. 4. Keto stabilizes blood sugar. No more sugar spikes. No more cravings every 2 hours. This is extremely beneficial for prediabetes, type 2 diabetes, insulin resistance. 5. Keto helps reduce belly fat. First, visceral fat, the dangerous fat around organs, responds quickly to low-carb diets. This is why many Americans and Europeans who switch to keto lose inches from their waist before they even notice weight changes. Number 3. The only foods you can eat on keto. Doctor-approved keto food list. To make keto simple, here are the safe food groups. Healthy fats primary source: olive oil, avocado oil, coconut oil, grass-fed butter. Ghee. Nuts and seeds: almonds, walnuts, chia, flax, low-carb vegetables. Spinach, broccoli, cauliflower, zucchini, asparagus. Kale, lettuce, proteins, eggs, chicken. Turkey, beef, salmon, sardines, shrimp. Keto dairy if tolerated, Greek yogurt unsweetened. Cheese, heavy cream, drinks, water. Green tea, black coffee, electrolyte drinks without sugar. Foods you must avoid: even small amounts break ketosis. Bread, rice, pasta, potatoes, sugar, sodas, fruit juices. Most fruits except berries, packed snacks. Keto is simple if it's high in. Number 4. The 3 stages of keto. What most people don't know. To understand your body, you must understand these 3 phases. Stage 1. Carb withdrawal, days 1 to 4. You may feel sugar cravings, low energy, irritability. This is normal. Your body is switching fuel sources. Stage 2. Entering ketosis, days 4 to 14. This is where major changes happen. Signs you're entering ketosis: dry mouth, reduced appetite, increased urination, mental clarity. Light breath odor, temporary. Stage 3. Fat-adapted state, weeks 2 to 6. Your body now understands how to use fat efficiently. Benefits include high mental focus, steady energy, rapid fat loss, no food cravings, better sleep. Most Americans and Europeans feel dramatic changes once they reach this stage. Number 5. Benefits of keto supported by USA and Europe-based research. Keto is not just a trend. Multiple studies support its benefits. Rapid weight loss. Human nutrition and metabolism studies show keto burns 2 to 3 more fat than a normal diet. Reduced inflammation. Chronic inflammation is extremely common in Western diets. Keto reduces inflammatory markers like CRP. Improved heart health when done properly. Lower triglycerides, higher HDL good cholesterol. Mental clarity and brain support. Ketones are an excellent brain fuel. This is why doctors still use keto for neurological conditions. Better blood sugar control. Diabetes research confirms keto significantly improves HbA1c levels. PCOS improvement. Lower insulin gives better hormone balance, gives better fertility. Reduced liver fat. Keto is highly effective for non-alcoholic fatty liver disease and AFLD, which is increasing in both USA and Europe. Number 6. Side effects. Keto flu. What to expect and how to fix them. During the first 3 to 7 days, some people feel headache, fatigue, muscle cramps, brain fog, irritability. This is called keto flu, and it is temporary. How to fix keto flu? Drink more water. Add electrolytes, sodium, magnesium, potassium. Don't cut calories too quickly. Eat more healthy fats. Rest well. Once keto flu passes, energy levels increase dramatically. Number 7. The safest way to start keto. Doctor recommended method. Here's the beginner-friendly method for USA, Europe diets. Step 1. Reduce carbs below 20 to 30 grams day. This is non-negotiable. Step 2. Increase healthy fats gradually. Don't load all fats at once. Your digestion needs time. Step 3. Add protein in moderation. Too much protein converts into sugar. Step 4. Add electrolytes daily. Western diets often lack magnesium and potassium. Step 5. Track your progress weekly, not daily. Weight loss fluctuates. Step 6. Don't skip vegetables. Fiber prevents constipation. Step 7. Avoid cheat days for the first 30 days. A single cheat day can break ketosis. Number 8. Who should avoid keto without doctor supervision? Keto is safe for most people, but some must consult a doctor. Pregnant or breastfeeding women. People with kidney disease. People with gallbladder issues. Type 1 diabetes. Anyone on medications for blood sugar. If you're unsure, get medical advice first. Number 9. Common mistakes people make on keto that stop weight loss. Eating too much dairy. Dairy can stall weight loss. Eating too many keto snacks. Most are full of hidden carbs. Not drinking enough water. Dehydration is common on keto. Overeating protein. Protein raises insulin if excessive. Not tracking carbs. Even vegetables have carbs. Giving up too early. Your body needs at least 14 days to adapt. Number 10. A full one-day sample keto meal plan. USA. Europe friendly. Breakfast. 2 eggs cooked in olive oil. Avocado slices. Black coffee. Lunch. Grilled chicken breast. Steamed broccoli. Butter or olive oil drizzle. Snack. A handful of almonds. Dinner. Salmon fillet. Asparagus sautéed in olive oil. Total carbs equals. Number 11. Long-term results. What you can expect after 30 days. After 7 days, less bloating, reduced cravings. Better sleep. After 14 days, clothes fit better. Energy increases. Mental clarity improves after 30 days. Significant weight loss, lower inflammation, better digestion. Improved blood sugar, clearer skin. These results are common across USA and your final message. Keto is not magic. It's science. When carbs drop, insulin drops. When insulin drops, fat burning begins. If you're looking for a simple, doctor-supported way to lose weight, gain energy, and improve your metabolism, keto may be the right choice for you. But always remember, For more important health advice like this, make sure to subscribe to the channel.